I'm Mona Locke, Chief Communications Officer here at Swedish. We know it's important for you to feel safe when coming to the hospital, especially since the governor gave the green light for elective surgeries. Safety is our top priority, so we want to show you how that process has changed since the COVID-19 pandemic. Joining us now is Dr. Marc Horton, who is Executive Medical Director of Surgical Services. Welcome, Marc.
Hi there. Nice to have you here.
We want you to just talk us through how it's different now.
So what we do now is we try to test every single patient who's going to have a procedure done here, a surgical procedure or other type of procedure. And we've set up soon to be five, freestanding in-hospital clinics where people can come and get their tests done 48 to 72 hours before the procedure. You can see here where people come in and there's social distancing. These nice people do initial screening here with regard to temperature and symptoms. And then we follow off down here following these signs for the pre-admit clinic here.
So every person that comes in, they have to come in actually in advance to get tested for COVID.
Right, so that's an ever-changing process, and the process we're doing right now is that your surgeon or your proceduralist will actually create a list of people who are going to be done 2 or 3 days in advance, send it to this center. These people will then call patients and have them come in a preset time to get their test done. Again, as you can see, we've got arrows, we've got places where we can stop for social distancing, and we'll go down here to the pre-admit center testing. One of the important things here that I think we really need to emphasize is we are doing everything we can to test each and every one of our patients so that we can remove any positive patients out of the mix. COVID positive patients, for the reason being that it changes everything about what we do. In an urgent situation, sometimes we don't have that luxury. These are for all planned procedures and surgical procedures, and it makes a great deal of difference. Come through here, you meet these nice people. They've got you scheduled in the computer. You verify things here, and then you have a seat back over here. And then again, for the social distancing, they call you in as you go back to get your test.
Okay, doctor, when a patient comes for COVID testing, they have to see the hack first, and then the hack will print the requisition. And then after I register the patient,
right,
the patient and the hack will bring them to the room for the COVID testing.
Patient come in here, and there's different testing rooms all the way along. And so you're going to meet someone who's going to do your test.
They're coming in here to get tested.
Yes, they're all pre-surgery, so we want to make sure we test them for COVID 48 to 72 hours prior to having surgery. So we do have them scheduled. We schedule them on the computer. They come on in. We have a lab requisition. This is like very similar to the regular flu AB swab. It's just into the nares. So we swab, put it in the container, label it, send it to the lab. The lab will forward it to the doctor, and they should have the results before surgery.
How long does it take?
It is a quick walk-in, verify who we have in the swab, the nose, and it's that quick.
And you're done.
I actually prefer them to come on in, stand, swab, and go.
Great.
So the biggest thing that's the difference now compared to, let's say, 6 months ago before all this happened, is what's going on right here. You used to just come in the hospital, maybe ask for the information desk if you hadn't been here before, and then just go over there and get in line at registration, and you just went through the process. Now what's happened is that people have looked at you in advance, 2 to 3 days. They've sent you somewhere for a special test. Even with that test being negative, you then come through here and get screened in case anything's changed with regard to your symptoms or whether you have a fever. All those things being normal, then you go over here and in social distancing, go through registration, then go to the transfer area where you're going to change your clothes and get into your gown and stuff, and then go to the operating room. What we do in the operating room actually hasn't changed at all unless we know that you're positive. And if we know that you're positive, then we take different precautions.
If you come in and you test positive, what happens?
You're told that's the reason we want to test ahead of time. You don't find out here. You find out the day before that your test came back positive, and there's an algorithm of what we do to send you back to your regular doctor or to infectious disease doctors to get that taken care of appropriately.
So then they would come back after they had been cleared.
Correct. So once you've been cleared, you pick up your registration material there, and then you head over here. We're just entering into the transfer area. This is where you come before you go into the operating room. This is where you meet your anesthesiologist and your surgeon. There are partitions now between all the beds, and people now are distanced from where they were before. And there's less bays than we used to have, but this is the sequence of where people would go. And like I said, this is where they meet anesthesia. The nurses make sure everything is done accordingly. So what we've done so far is we've gone through pre-admit testing, we came through registration, we went to the transfer area, then you get taken into the operating room. We can't go inside, but you can see, so there's 3 rooms here on this side. We have a total of 20-some rooms upstairs here. It's a very busy place, and what goes on in here with regard to sterility and everything else isn't anything different than it's been pre-COVID or post-COVID as far as we know at this point. And then after the operating room, then you come here in the recovery room. And these are also partitioned with drapes in between each one. If we need to, we increase the number of spots, or distance rather, so there's less spots. And then this is where you recover from general anesthetic before you either go upstairs to be admitted or go home.
Perfect. Thank you so much.
You bet.